Brenda, welcome. I want to let you know how much it means to me and the Center for Character and Social Responsibility that you're sharing your time with us to talk about the role of caring, character, and commitment as a leader during times of crisis. These past few years have been filled with myriad challenges, including a pandemic, major political changes, conflicts throughout the world, responding to climate change, and increasing emphasis on the importance of getting equitable access to a high quality learning experience, even as the definitions of equity and high quality learning are changing. You have been a leader of a PK-12 institution during this time, and we are very interested in learning how caring, character, and commitment to students, faculty, and students have influenced your leadership decisions. To get going, would you please introduce yourself, your position, and describe the educational institution of which you are a leader?
Well, thank you, Dr. Coleman, for having me on today and to share some of my experience. I'm Dr. Brenda Cassellius. I am the superintendent of Boston Public Schools, and I lead an organization that is about 52,000 children, most who come from diverse backgrounds. About 85% of our students are high need, students of color. 22% of the students are special education, and we have about 50% of our students who speak a home language other than English. This public school system is the oldest school system in the nation and has some of the oldest school facilities in the nation, and also has about 35 universities surrounding it. So an incredible opportunity that we have here in Boston to leverage the capacity of the city in the interest of children.
Okay, good. And would you share with us your journey into educational leadership?
Sure. I grew up to a single mother who had my sister at 16 and had me at 21. And I lived in the projects most of my childhood or in public housing. Went to 7 different elementary schools, starting with Head Start. So I am a Head Start baby. And also the bookmobile used to come into my neighborhood. And so I had opportunities at the local park and rec center and by wonderful teachers, my kindergarten teacher, my preschool teachers, the bookmobile, my camp counselors when I would go to camp. And these folks really buoyed me up as a young child. And so I really got an interest early on in education and working with children, and really working with underprivileged children. I worked at the Crisis Nursery for Catholic Charities as starting out my career, and worked with alternative school students who were adjudicated, and also then went into being a paraprofessional as I was getting my teacher credential. And then became a teacher. I became a school leader in middle school and high school, and then was asked to go to Memphis with Dr. Carol Johnson, who was a former Boston superintendent, a wonderful mentor, and then went back to Minnesota as high school superintendent, Minneapolis Public Schools, and then also became superintendent of East Metro Integration District, which had a wonderful vision of integrating schools. And then very shortly after achieving the superintendency, I was called by the governor of Minnesota, the new governor of Minnesota, Mark Dayton, to ask me to be the state commissioner of education, which I did for 8 years. And when he decided not to run again, I decided that I wanted to go back into urban education, become a large urban school superintendent. And I started my search, and that brought me here to Boston.
Great, thank you. And so what do you appreciate about your position as a superintendent and/or your institution or BPS? And then what are some of the unique challenges you face in your role?
Well, what drew me to Boston was the rich diversity, and particularly working with Black students and Latinx students who traditionally have been underserved. And so I was seeking that population of students to do my work. And, God has always directed my path. I'm a pretty spiritual person that way. And so I go where the doors of opportunity open for poor children and children most in need. And so that's what brought me here. And I think that this particular role has been quite challenging because of the pandemic, as you know. And so that has caused a little bit of a snag in the plans that I had set. But hopefully we'll turn the corner and we'll be able to get back to the strategic direction that we have to make this one of the highest performing systems in all of the country.
Great, thank you. So how does care and being caring play into your decision making? And also, where is that challenge? Where is it challenge to allow care and being caring to be part of your decision making?
Well, creating a caring and welcoming environment for our students and our parents and our key community members and partners and our educators is essential to building trust. And building trust is demanding on a set of values that you have, and when you can create a caring environment and a trusting environment, then you are able to build deeper relationships. And it's the relationships that you build that allow you then to have learning happen. And all learning is a social construct, I believe. I'm very familiar with Dr. Comer's work. He said no significant learning happens outside a significant relationship. And if it's not a caring and warm environment and one built on trust, then I'm not certain how you can get much learning out of that.
Great, thank you. So when you think about character, what does that mean to you? And how do you see it playing a role in your decision-making as a school leader?
So character is your internal-most values and principles that you have. I think that you always know when somebody's principled because they're consistent. And so when you have a deep character, that is what you go to all the time as sort of your rock and your pillar and your North Star to your decision-making. And so Governor Mark Dayton taught me that, a budget is always a reflection of your values, and so that's really a sentiment about having deep conviction and deep belief systems based on a core set of values. And those typically make up your character as a person. And what you see on the inside ought to be what people see on the outside consistently in your actions and in your deeds and in your words.
Yeah, and we know how hard that is to do consistently. So in PK-12 education, there are three major constituents: the students, their parents, and their teachers. They each have different needs, and those needs can sometimes exist in tension with one another. In your work, how do you manage and balance your commitments to each group?
Well, I have a saying on my door, as you know, because you've been to my office, that says measure everything in child benefit. And so it's easier for me because I center myself on the child. And I have always centered myself on the child, sometimes to the disease of the adults around me. And so when you take your caring and your character and you center yourself on children, it's a mighty force of consistency then in terms of your actions that you take. And so I've always been centered on children. And then I also believe that children don't come as just little human beings. They come in systems. And so, it's the systems that have supported children. It's the adults who create the conditions in which children succeed. And so to be child focused, you also have to focus on the family. And families are supported by communities. And so you need full communities supporting families and families supporting children and children being supported within the learning environment. And that's how I keep my center of focus and how I balance the different interests, around how we support our children.
Brenda, thank you for that, because I as you share that, it kind of came opened up for me, and I just want to make sure I heard this right. So in your world, you center your work around the needs of the children, and then see the teachers and the parents and the other community members as your collaborators in getting those needs met. And is that a simple, a short way to kind of hear your organizing principles?
Exactly, but it also means that we can't, as we center on the child, we have to realize that it's the systems that we build around the
Mhm.
child of support,
Mhm.
because it's the adults who create the systems in which
Yep.
children succeed.
Yep.
So as you focus on the child, recognizing that the adults also have to be fed and have to be
Mhm. Mhm.
enlisted into the support of children and invested in the support of children collectively.
Great. That's a great point. Thanks for that clarification. So over the past several years, particularly with regard to the variety of crises educators have faced, can you give us an example of how putting caring, character, and or commitment to others first as a leader has had a positive impact on your institution?
Well, we were all thrust into this pandemic the past 19 months, and you had to do it with empathy. I was so grateful to you, Dr. Coleman, who very early said, in some of your mentoring gentle ways to say, make sure that you lead with empathy. And that is around caring and understanding and listening and trying to gather what it is that the people need. And this was a time really where, as we focused on children, we also had to focus on families, because families had so much of the responsibility. So we found new ways to partner with our families. We increased interpretation services so that we no longer had barriers for their involvement in their children's education and translation, making sure that they got the information in a timely way. We added family liaisons to our schools to support families that were in crisis, to ensure they had health and safety information,
Mhm.
because we were really, over the past 19 months, um, dealing with basics, Maslow on the bottom foundational level, which was just survival.
Mhm.
And typically a school superintendent might deal with that with one child or one family or multiple families within a school. Whereas we were dealing with that with adults in the school, with children in the school, with families,
Mhm.
at the school level, at the city level, at the state level, at the national level, at the international level. Every single person in this global crisis was affected by this pandemic in some way, shape, or and we've had to respond to that. And so I think that that's proven to be very challenging,
Yep.
but it also has proven to provide
Mhm.
a lot of more ingenuity around how we collectively support children in the continuity of their learning and care for their health and safety and well-being.
It sounds to me, Brenda, like you suggest that I'm hearing that the more you center caring around the needs of the children in our schools and their families and the community, the more that's centered, the more when you have to make a quick decision and adapt to this crisis, the more you're guided by that caring, the more creative and responsive you're able to be, and not worry so much about long-term impacts, understanding that the immediate care is what's going to drive our system forward. Is that a fair summary of what you're saying?
It is absolutely, and there's a great article that I pass around. It's about, the love, teaching math, but you also have to teach love, right?
Mhm.
So, it really is a love principle. And, there's all kinds of things that go with love, and how you exude love and show love to one another,
Mhm. Mhm.
and work through really difficult conversations. And even within just the pandemic, we had George Floyd, who was murdered, and the care and the love that was needed at that time for our African American community, the Asian hate crimes that were happening, and the care and love that we needed for our Asian community in terms of our response was critical. Now with what's happening in Afghanistan and in Haiti, there's just so much going
Mhm.
on around the world that to
Mhm.
neglect to care, I think would be a mistake in the fact that I don't think we could have a really full relationship with families and with children, and therefore that would impact the learning.
Great. Thank you. Thank you. Can you give me an example of a time when centering caring and commitment to the needs of children and others did not work out the way you thought it would?
Well, there's been times when I've had to reconstitute a school. And that could be perceived as not caring about the community that was there. I think those are the hardest times, when you have to close a school or reconstitute a school because the community feels as though you're breaking them apart. And those are the hardest decisions I think superintendents have to make. But they're made because either the school has multiple system failures around children, or it's just not viable, or there's a building emergency or something like that occurs. But that's always the last straw to close a school in the community. But those are the hardest ones to work through. So you have to be even more intentional and deliberate in expressing and showing that the reasons why you're doing it, that it is steeped in the love of the community or the betterment of children. And so, it's just really important that you take the time to do that well, or it really gets in the way of trust, and it goes against what you say about caring, and then it doesn't square with the consistency that I said that you need around your personal character.
Yeah, no. And you must have great empathy with President Biden, because as business leaders, this conversation that so often when you turn to make the hard decisions, people will say, well, if you give me this much more money, if you give me this, if I get that, then I'll turn around. But then when you have a 20-year history of lack of success, that hard executive decision of how do you care for the system by making a very tough choice. So that's very demanding in your work and any executive's work.
And all leaders, that's why it's important to have such a strong sense of character, right? And be very principled. We know where Joe Biden lands on his principles. We weren't so certain with the previous president. And so when people are wishy-washy, you don't know what their principles are. Like, you can disagree with their principles, right? But you need to know what they are. And that way then you can understand and trust their decisions, even if they're decisions that you don't want to make. So as a leader, it's important to be consistent and to be principled, so that those who are around you know where you're going to take a tough stand, and they're not surprised by the tough stand because they know that you're principled and the reason why you're making the decision that you're making. And sometimes leaders are called to make unpopular decisions. During the pandemic, we're seeing this all across the nation right now on these mask debates or the debates around vaccines. But it's my job as a superintendent to keep the children safe and to look at the science. And because people know that I'm going to look at the science, and they know that I'm going to make tough decisions in even the face of adversity, then they can trust. They may not like it, but at least they know that what my principles and my character is.
So before we let you go, as you think about how you have integrated caring, character, and commitment into your leadership style while managing crises over the years, what advice would you give your younger self?
Oh, well, when I was younger, I thought I knew everything. Now that I'm 54, I realize I have still so much more to learn. But I think the advice that I would give myself very early on was just to continue to grow in your courage and your willingness to stand on your principles, and to not be swayed, and just to continue to look for ways to get small wins for students and see that as progress. And continue to move forward in the face of adversity.
Great. Well, Brenda, again, thank you so much for sharing time with us. And we really appreciate both your leadership and your model of caring and character and commitment. It's so valuable to both the kids and the adults in your care. So I want to thank you for that.
Well, thank you, Dr. Coleman, and thanks for all that you do.